Hello, everybody. I just want to say hello and thank you for joining us today for the kickoff of the third annual Hackers for Birth Justice Hackathon, an event where tech and birth equity meet to improve Black infant and maternal health outcomes. Today's event is co-hosted by Twilio and UCSF Preterm Birth Initiative, also known as PTBi. I am Leandra Pitts, your moderator for today, and I am a product owner here at Twilio for the top of funnel portion of the sales cycle, as well as one of the Black Twilion ERG leads. Today, we are going to learn more about what birth justice is and why it matters. Also, we'll see a demo of the Wolomi app, a pregnancy companion app from the talented Layo George, as well as learn more about the hackathon logistics and best practices. So again, I am Leandra. Also, Bianca St. Louis will also be a moderator as well. Cool. I went through kind of our agenda already, so we'll learn a little bit more from Jamisha and Lauren, as well as the demo, and then go through what to expect with Bianca. Awesome. So let's see here. Our guest speakers, Jamisha Wade and Lauren, are from PTBi, and they will be sharing about the amazing work that they do to eliminate racial disparities in preterm birth and improve health outcomes for babies that are born too soon. So I will hand it over to you all.
Thank you so much for that intro, Leandra. And welcome, innovators, creators, change makers. My name is Lauren Newman. I am the Design and Communications Manager at the California Preterm Birth Initiative. And I am a mommy of a precious, almost 4-year-old. I have a 3-nager on my hands. For those who have toddlers, you understand. But I'm going to go ahead and Jamisha, why don't you go ahead and introduce yourself, and then I will dive into a little bit about PTBi.
Thanks so much, Lauren, and thanks, Leandra, for that introduction. My name is Jamisha Wade. I'm the operations analyst with the California Preterm Birth Initiative. Like Lauren, I am also a mom of a toddler, a 3-nager. I have a very precious little girl named Journey, and she is taking me on life's journey. And so this topic, this Black maternal health topic, means the world to me. This is my life. This is Lauren's life. This is, the life of Black mothers. So thank you all for being here with us today.
Amazing. Thank you. We can stay on this slide, on that last slide, Leandra. Thank you. So today we stand at the forefront of the fight for birth equity. The UCSF Preterm Birth Initiative is thrilled to have you guys join us for this hackathon. Preterm birth disproportionately affects Black and Brown communities. It's a complex issue with social determinants of health playing a major role. But PTBi does not do this work alone. We very much believe in the power of collaboration. We bridge the gap between research, community partnerships, and education. But for real change, we need you guys' brilliance. This hackathon lives at that same intersection. Over the next 2 days, you'll leverage your tech expertise to develop solutions alongside Black and Brown families who understand the challenges firsthand. You can go to the next slide, Leandra. Thank you.
Yes, so with that, like Lauren said, we'll be working together in groups today. We'll be learning more about the Black maternal health crisis in the United States to help come up with these different tech solutions. And right now we'll go into a little more in depth about the Black maternal health crisis in the US. With that, we have a multiple choice question for everybody. We want people to drop their answers in the chat. So here on the screen, we have in 2021, the maternal mortality rate for Black women in the United States was how many deaths per 100,000 live births? So we have A, 69.9, B, 54.7, C, 38.2, or D, 47.9. So we'll give you some time to drop your answers in the chat. Oh, it's coming through fast. It just start coming all of a sudden. I'm seeing A, B, C. I'm seeing a lot of A, B. What else is coming through? Sorry, let me pull up the actual chat. Keep them coming, keep them coming. See A, B, D, A, B, A, D. We'll get a couple more. There goes another B. I'm seeing mostly A's, some B's, and a couple D's sprinkled in there. We can go to the next slide to reveal the answer. The answer is 69.9. So 69.9, the maternal mortality rate for Black women in the United States was 69.9 deaths per 100,000 live births in 2021. Black maternal health is in a state of emergency here in the United States. The U.S. has the highest rate of maternal mortality of wealthy nations, and although rates have skyrocketed over the last 2 decades for all women, Black women are around 3 times more likely to die from pregnancy-related causes than white women. Here on our screens, we have 3 different charts listed: preterm birth rates by race and ethnicity, infant mortality rates by race and ethnicity, and maternal mortality rates by race and ethnicity. And we'll dive a little deeper into some definitions and statistics. So you might be thinking, if mortality rates are up across all women, why are we focusing on Black women today? The simple answer is good health won't be a reality for all women unless we address racism as the root cause for poor physical and mental health for Black women. So again, chart 1 goes over preterm birth rates. Preterm birth is defined as live birth before 37 completed weeks of gestation. March of Dimes reports that in 2021, 1 in 10 babies, or 10.4% of live births, was born preterm in the United States. This chart here shows the preterm birth rate for Black babies at 14.6 per 1,000 live births, or 4% more than the national average. Infant mortality is defined as death occurring during the first year of life. In the United States in 2021, 19,944 infants died before reaching their first birthday, making this an infant mortality rate of 5.4 per 1,000 live births. The number for Black babies is nearly double, as you can see here in the chart. This number is disproportionately higher than any other group listed. Maternal mortality rates are also shown here by per 100,000 live births. Maternal mortality is defined by the World Health Organization as the death of a woman while pregnant or within 42 days of termination of pregnancy, regardless of the duration, but not from accidental or incidental causes. Maternal mortality rates, again, are shown here in the 100,000s. And like we learned earlier, the maternal mortality rate for Black women was 69.9 deaths per 100,000 live births, more than double the rate of white women and Hispanic women. So there are a plethora of factors that can lead to preterm birth disparities in the US. Laid out here, you can see different factors broken down that ultimately lead to preterm birth health outcomes. Upstream causes are social-related factors of health that include non-medical factors like education, socioeconomic status, race and ethnicity, and all of these things can ultimately impact health outcomes. Midstream causes of health can prevent people from achieving optimal health. These factors include things like psychosocial factors, health-related behaviors, and the role of the healthcare system that lead to all of these social risks. Downstream factors of health are diseases and injuries that can result from upstream factors of health. So if we have unfair laws, unfair structures, all of these policies, and a Black mother is facing harm and injustices within these systems, this can ultimately lead to a downward spiral of her health. Biological mechanisms is your body's reaction to outside factors that ultimately lead to these outcomes as health as well. All of these things lead to preterm birth disparities overall. Preterm birth is the leading cause of infant death. Here in California, more than one third of all infants are related. Here in California, more than 1/3 of all infant deaths are related to being born too soon. Babies born prematurely who do survive can often face a significantly increased risk of cognitive disability, poor school readiness, and many other medical and social challenges. The impact is felt for a lifetime by these children and their families. This includes emotional and financial tolls for the family in the long run. This can lead to an ultimately unfair life and potential loss for the Black community. All of this data paints a picture from how to start. Without the proper care, you are likely to suffer from birth into adulthood. A Black mother's health and quality of care can determine the quality of her life, her child's life, from childhood into adulthood and beyond.
Thank you, Leandra. And I'm sorry for mispronouncing your name earlier. It's like in your bio. I don't know what I was thinking. But thank you for that. So Black maternal health crisis in the news. Jamisha so eloquently described the stats that we are that we are up against. So why this disparity? It's rooted in systemic racism within healthcare. Black women often face implicit bias, inadequate pain management, and a dismissal of their concern. This hackathon is a call to action. We've highlighted a few viral cases that have happened in the Black maternal health crisis. Some may know that Serena Williams almost passed away after giving birth to her child and suffering a pulmonary embolism. And that was in 2017. If we fast forward to 2003, Tori Bowie, an Olympic athlete, died alone after beginning the laboring process from eclampsia. And then just this year, we have beauty influencer Jessica Petway, who died after being misdiagnosed with fibroids, and she had stage 3 cancer. So we're not being heard still in 2004. And so this is our call to action today. Now we can go to the next slide. So why tech? Black women are not waiting around for the system to catch up. Let me tell you, they are turning to the power of tech to bridge the gap. We've seen apps designed by Black women for Black women, offering support networks, culturally relevant information, and even tools to track health during pregnancy. This hackathon is a continuation of that fight. We have the chance to create powerful tools alongside the very community they'll impact. We can build solutions that empower Black mothers to advocate for themselves, navigate the healthcare system, and have healthy pregnancies. Let's not just code, let's create change. Let's build a future where Black women can experience motherhood with confidence and joy. The time to hack for Black mamas is now. We also had the pleasure of highlighting these amazing apps that are already in the world. There is the Birth by Us app. There's the Mommy app. You guys can see these on our Instagram at Voices for Birth Justice. I will drop that in the chat. Can we go to the next slide? Thank you so much. We have the Wolomi app, and we have Layo here actually speaking, so that is a pleasure. And then we also have the Earth app. And if you guys would like to read more on these individual apps, again, they are posted on our Voices for Birth Justice Instagram page. As I mentioned before, this is a collaboration. We are not able to solve the Black maternal health crisis on our own, and we are hoping to bridge this gap and make this a collaborative effort. And these are just some of the folks that we are happy to be in collaboration with.
Leandra, can you go over one slide? I think we might be, or maybe I think we might adjust them, but it's totally fine. Later on, Bianca, she'll talk more about some of our objectives and what we want to leave with from the hackathon and some of those things. So right now we'll talk more about some of our community challenges and focus areas or themes of today's event that we want to focus on in the Black maternal health space. So number one, we have provide respectful care that is free of anti-Black racism to the birthing person as well as their support network, boost effectiveness of anti-racism training to focus on addressing anti-Blackness, promoting action and producing meaningful results, strengthen recruitment and retention strategies to increase the number of Black professionals who interface with Black birthing people in communities, improve data collection, accuracy, interpretation, dissemination, and utilization practices, and lastly, enhance postpartum support to fully meet the needs of Black families. And again, these are some of the themes that we're putting out there today. You don't have to stick to these. We just want to put these out there to help get you thinking about what your tech solutions can solve for. So as we dive more deeply into these focus areas, we have problem statements that we want everybody to think about as they choose their themes, right? So for respectful care, something that you can think about when a Black mother experiences disrespectful care, what are the options that they can take to seek accountability and justice, right? Hospitals often don't have the appropriate systems in place to report negative experiences. And when they do, there's often no follow-up or action taken. It can be important to provide an avenue for the Black community to seek accountability and justice where trends and patterns can also be tracked. Anti-racism training, again, to get you thinking about some of those things within this theme. There's often no way to measure and ensure the impact of implicit bias training on real changes in medical practice. Even in states like California, where there's mandated perinatal provider implicit bias training, there is often no way to measure the impact of this one-time training, especially if changes are continuing to happen in practice. Real-time feedback into continuous training or coaching on anti-racist practices could often be more effective to create change. Recruitment and retention. How do we recruit more Black providers and help Black moms get access to Black doctors if they want one, or in a lot of cases, if one is needed, right? So it goes deeper than wanting one. It goes even as deep as needing one for one's health, right? Research shows that there are improved outcomes in reports of more satisfaction from Black patients when treated by Black doctors, midwives, nurses, doulas, breastfeeding consultants, and other care providers. For example, the mortality penalty of Black newborns are half compared to white infants when cared for by Black clinicians. In counties that have high numbers of Black primary care physicians result in a longer lifespan for their Black communities. Expanding the Black perinatal workforce and on-demand access to Black perinatal providers could ultimately save lives in the long run.
Wonderful. I'll pick it up, Jamisha. So data collection. Quality research is vital to systems and policy change. How do we ensure that survey data used for research is accurate and scam-free? Surveys and interviews are a common part of research, and in almost every case, participation is compensated. The addition of compensation, which is a necessity, is recognizing participant time. Often attracts scammers who impersonate the targeted audience and bots created by scammers. This can compromise and slow research efforts to a crawl, even with the many modern day technologies to disrupt bots. Thank you. Postpartum support. How can technology help solve for maternal health deserts in the US, specifically to support postpartum moms? Research shows that moms are typically already underserviced in the postpartum fourth trimester. Living in a maternal health desert without access to obstetric care exacerbates the lack of postpartum support that many people experience, which may contribute to the high rates of postpartum depression. Furthermore, the March of Dime reports that counties without access to telehealth are 30% more likely to be a maternal health desert. That is the conclusion of our portion. I appreciate you guys all tuning in. I hope that you got a better understanding of what we are fighting for today and the outcome and solutions that we hope to gain at the end of this hackathon. So thank you for your ears, and looking forward to seeing what comes of this.
Awesome. Thank you so much. Next up, we will hear from, oh, what just happened?
Apologies. We're gonna share a quick video that highlights the work of Wolomi. We just had a some mild tech issues. Cool. Righty. Should be full screen. Thank y'all for your patience.
Show it off, every curve, every part, yeah. Cause I'm strong and I love the skin. I'm in every shape, every inch, no doubt.
It's helpful to share experiences and struggles and victories as well.
Cada semana me mandan mensaje y me siento preparada cuando voy a mi cita médica.
Every week I get something written by a midwife of color to help me prepare for the appointment with my provider.
People who are like me, explaining some of the things that I go through, but I'm too scared to share with others who may not be going through what I'm going through, who may not know what I'm going through.
I'ma be my best self. I'ma be, I'ma be my best self.
Alrighty, awesome. Definitely wanted to make sure y'all can see me. Start video. Hi, everyone. My name is Bianca St. Louis, co-moderator, host. Super excited to have you all, but even more excited to introduce Layo George. So Layo George is the founder of Wolomi. So Wolomi is a perinatal health company that strives to create innovative ways to improve outcomes for women of color. And I think what's so beautiful about Layo's story is that, this is personal, right? So it's not just, some random person creating a solution, but this is a lived experience. I also want to, I like to say, give Layo the full, bio intro. So lots of amazing experience. So Layo George is currently the CEO and founder of Wolomi. Wolomi is a perinatal health company that strives to create innovative ways to improve outcomes for women of color. Layo has experience working in both acute and primary care settings. She also has expertise in assisting healthcare organizations transition from pay for performance to value-based, patient-focused, and outcome-based systems. Layo has worked on one of the Center for Medicare and Medicaid Services innovative grants, pioneering the way for citywide care coordination in DC. She also has worked as a quality improvement specialist in the District of Columbia Primary Care Association, leading primary care members through care and practice transformation. Layo was appointed to the DC Board of Nursing, continuing her work in strengthening the healthcare system. She previously served as the vice chair on the District of Columbia Department of Healthcare Finance, HIE Stakeholder Committee. She is currently on the board of Unity Healthcare System, the largest federally qualified health center in the District of Columbia. Layo is a nurse with a master's in health system administration from Georgetown University. And if you want to connect with Layo on socials, you can connect via Wolomi, the Wolomi app. So we're super excited to have Layo George just share a bit more about Wolomi and just how she's translated an idea to an innovative solution. So Layo, over to you.
Yeah, thank you so much, Bianca. I'm excited to be here and be with a lot of people who are really thinking about this crisis that we have. So my name again is Layo George, and I started this journey because I didn't want to die on my own pregnancy journey. If there was a birth plan that I had, it was that, right? As you know, it doesn't matter if you're rich, if you're poor, whatever it is, it's kind of like any Black woman can get it, right? So, and that's kind of how it was for me on this journey. And so, yeah, that's how kind of where Wolomi started. We are a digital platform that support women of color and marginalized communities on their perinatal health journey. And we partner with different health plans, employee, and just organizations who are passionate about solving this issue. So I'm going to tell you a little bit of a story. I call it a survivor story. We were contacted by a mom recently who really was, she was really looking for someone to support her on her postpartum journey. She was looking for somebody who can help her breastfeed. So she came on the app, and one of our mama companion was able to talk to her. And on having conversation with her, we could just sense that this mom is just going to, there's a level of stress, and there's a level of suffering that this mom was having as she was talking and focusing really on this thing, focusing in on she just wants to breastfeed. And as we were having that conversation with her, we decided to go in deeper, and we found out that this mom has been at home and has been having her blood pressure just going up and up. And this is a Black mom who is at home, has a BP blood pressure cuff monitor that was at home, that she was able to take the blood pressure cuff. And whenever the blood pressure cuff is high, she would call the 911 and just kind of tell them like, hey, I don't feel good, my blood pressure is this and that. And on occasion, she's had the 911 EMT actually come to her house and take the blood pressure cuff and take a blood pressure of her, and they told her that everything was fine. And so she was having she was third day postpartum at this point, and she was having this back and forth with the healthcare system. So here she was, she's having this blood pressure issue, and she's not feeling well. There's a level of suffering, and all she just wants to do is breastfeed this baby, right? And work through and get past the suffering that she was experiencing. And so we started to talk to her and say, hey, and coaching her and giving her the words to change the way that she was talking to the healthcare system, to go from first figuring out who her provider was, who her OB was. So this is like, she's an immigrant mom, right? And figuring out who our OB was. And once we were able to figure out who our OB was, we were able to then tell her, we need to change the way that we are having this conversation with the healthcare system. No longer are we going to be in the position where we're giving suggestion of what we want. We are coaching her to ask of the healthcare system, ask of the provider that she wants to see the provider immediately. Is it the same day or the next day? And so the mom was able to actually own that journey and be more empowered in their ability to say, hey, I'm not going to go back and forth about my symptoms. I'm going to ask for my appointment. I need to see a provider. And so she went to doctor's office the next day, 8:30 a.m. And from there, she was actually admitted to the hospital, and she spent a whole week in the hospital. And as we know that if anything with blood pressure, it needs to be treated when the blood pressure is high, especially in postpartum journey, it needs to be treated. And we do not often have the ability to just stay home and just go back and forth about and talk about the symptoms. It's a very immediate thing that needed to be treated. And so, ladies and gentlemen, just like that, the mom's life was saved. Imagine if she was in the house doing the right thing, quote unquote, right? I mean, we could say there's many different things that could have happened, but how many of us don't really understand how to navigate the healthcare system? Talk less of a Black mom who's an immigrant and all of this other compounding thing. It could be a Black mom who's going through a mental health crisis. There's so many things that can compound on that journey, and that makes us that gives us inability to navigate the system. And oftentimes we talk about it, just because you make something digital does not make it culturally competent, does not mean that we're designing a solution that understands the pain and the cultural nuances of a mom. And so that is one of the reasons why it's important to have platforms, right, that are created from the community, from the people and allies who truly understand and understand the journey and understand the nuances. Because when we look at the data that was presented earlier, we see that a lot of these things are preventable, and it could just be just different things that can happen that sometimes is not picked up by a non-culturally competent platform, or just because somebody have a BP at home does not necessarily mean that they are able to do the things that we want them to do. And so we already know about the problem. We know that we already talked about the data. But one of the things that I want us to think about is that oftentimes when moms are coming into this journey, it feels like we get pregnant, you know, the healthcare system, we contact the healthcare system, they kind of do whatever they want, and then they just leave us with the rest, right? Like we're left to deal with the damage or the trauma or whatever it is that that we have to go through by navigating the healthcare system. And so next, please. And so the most important is that we should think about why these things matter. For us, we're just not, it's not just about the numbers, right? It's about how it affects families like ours, how it affects our community. And I think one of the presenter earlier was saying that it's important for us to leave the world a better place. It's important for us to leave the world, to leave our generations better than the world that we found it, so that we can all have better outcomes. And I say this because as things progress, as things change, we'll begin to hear things like, it doesn't matter, it's just Black women dying, it's, you know, equity is nonsense, you know, like all of those things, we'll begin to hear them. And I think it's important for us to stay true to the things that we're doing, stay true to knowing that we're in this because we want it to be so much better for our generation. Next. And so as we're here talking through the role of tech, I know a lot of us that will be working through the different ways that we can improve outcomes and using tech. We at Wolomi, we really see tech as a useful tool from the mom's perspective in the community. And there's multiple ways that you could create tech, right? You could create tech from the healthcare system perspective and all of those things. But we see tech as a way of empowering moms and enhancing communication and really improving access to better cultural competency, cultural competence care. And oftentimes it's not that the mom is not going to those appointments. Sometimes they're going to those appointments and nothing is happening. There's those nuances, they're not being listened to. The provider doesn't understand their culture, and that there's no greater place that exists. And when we talk about infant mortality, right, we know that there's a greater correlation between having a provider, a pediatrician that looks like your kid, and early intervention and early detection. So this is a place that we can save lives, and we can really use data to really have data-driven solution and really dig deep into each region and each specific area, and really create solutions that can improve outcomes. And so our vision at Wolomi, it's really to be community-based. We're all about community. We really want to build that community for moms, and really in that community have education and support, and so that we can have better outcomes and really be on that and have joy on that journey. And how many of us have heard a Black woman, even if it's a doctor or someone who is like, I'm not going to have a child because, you know, I'm just so scared. And that is not what we want. That is not really what we see for ourselves. So our vision, just like our name, which is a greeting in Yoruba word in Nigeria, that says when a mom has a child, we say happy dipping hands in water, Eku Wolomi. So we just kind of shorten that and say, you know, dipping hands in water. It really takes a community. And when you think about us, we really see ourselves as sort of like the community health nursing, a modern day community health nursing, where we're with the mom and really supporting the mom in the community, creating community around them and the things and education and resources that they need. And so our solution, as you kind of saw a snippet of it, really puts the mom at the center of their care. Again, creating that community. We know we're very, as Black women, we're very community focused and we thrive in community. And so really having that bedrock to improve outcomes for us. And so even though you've seen some of the interface of it, but I'm just gonna go through like how some of the features that we have. I believe to be in community with the experts so that when you're going to that provider appointments, you're not having that white coat syndrome and you're able to go through your ideas with the providers so you're ready for your provider appointments, and then having that weekly support that's evidence-based, using our curriculum to really improve outcomes for moms. And then our midwifery-led weekly pregnancy updates. So that's based on gestational age. And then also the community events. So we not only do digital support, we also do in person. So again, we're very, very big on community and not doing this alone. And also, making sure that we're integrating mental health screening and SDOH screening and closing the loops on that. And we talked a little bit about our Mama Companion, this idea of moms who have lived experience, who are able to create goals for the moms. And of course, the doula support in the virtual birth classes. We know that moms are like getting their birth education on TikTok, just making sure that we're having something that's modern, that is evidence-based. And one of the data was showing that some of the reasons why we are having some of the bad outcomes could also be like how much spacing we're having, right, in between birth, how much we're understanding what it looks like to have respectful care. And so those are all of those things that we sort of cover in a way that's modern, that's easy to digest for the moms. So our impact since we've started, we kind of had different journey, right? As all startups do, and a lot of you are making products in this following days, we'll also see that it goes through different journey, and our journey can look very different. So we've impacted over 3,000 pregnancies to date, and moms who are participating in our program are getting to 37 weeks. We're seeing that they're getting to 37 weeks as they fully participate in our program. And we screen all of our moms and trying to have that closed loop referral. And we're with our Mama Companion, we're seeing 60% in engagement. And yeah, we have a decent balance of private insurance and Medicaid population. Next, please. And so, yeah, that's pretty much Wolomi. We would love to continue to partner to improve maternal health. And I just want to encourage everybody who's on here, who's thinking through their solution, stay the course. And we know that the reason why we're doing this is because other than the money and all of those things that, you go to investors and they ask, we have to remember that we're doing this because it matters to us, and we can never get tired of solving this solution because it affects our community as we know it, and how our community thrive. It really depends on having birthing people who are able to stay and celebrate their child in a healthy manner, and grow their community. Thank you so much. And if you can reach me, that's my email, layo@wolomi.com. And I'm just really excited to see so many products in the community just coming out for us to solve this crisis that we have. Any questions? Well, I don't know if I'm supposed to ask questions, sorry.
No, you're fine. We'll definitely, if you have questions for Layo, please add it to the chat. And then also Layo shared her email as well as just on socials. So please, please, please interact with their page. We would love to keep that conversation going. Thank you so much, Layo, for your presentation. So hi, everyone. My name is Bianca St. Louis. I am a staff developer community advocate over here at Twilio. So I work on our developer network team, and our developer network team, I like to say we're the engineers, we're the folks that just will encourage you and support you on your build. So typically we would have these hackathons for a lot of our enterprise customers. So a lot of the big names that you might see that use, tools like Twilio. And for us, we're like, but there's an opportunity for us to impact just kind of other topics, other areas. So, this became this kind of effort a few years ago that was just sparked by a lot of different folks really passionate about this issue. So we're three years strong. So definitely want to kind of just quickly go over just what to expect. I know we said if you're not, doing a hackathon, you could drop off, but you could hang out too, enjoy the adventures with us. Cool. So as we mentioned, kind of what are our priorities, right, for this hackathon? So first and foremost, increase awareness about the Black maternal health crisis. We do not need to give you more stats. It is very evident and clear that this is an issue. So we want to really leverage kind of this space to kind of expand this conversation. So that's one of our objectives. The other thing too is we want us to create solutions that can combat just the challenges. So between the presentation from PTBi and Layo, hopefully you feel a little versed around just like what are some of the top issues, where are some of the places that you can create an impact. And the other thing too is we want to create better relationships. There are a lot of technologists, and to be honest, not a lot of them look like me. And a lot of times the folks that are building the solutions don't come from the communities that are the most impacted. So I definitely think it's important that we start to foster the relationships, that we have the experts that live this, that have the insights, as well as just the folks that are able to build these solutions, right? So we really want this space to also be a place that maybe you'll create a new tech friend, a new person that can kind of help you build, and maybe you create a new doula, homie. And, we definitely want us to foster those relationships that can help us create, impactful solutions for the community. So what to expect? You are currently at the hackathon kickoff. And some of you should have, well, actually anyone who's kind of participating in the hackathon, you should have received like a team meet and greet and a brainstorm session. We wanted to kind of create a space that you can, connect with each other. Tomorrow morning, there will be a quick space just to kind of check in. I like to think of it as like the water cooler or the living room, right? Before you go into your different spaces. And then we'll have team building, and then we'll have a demo ceremony. So we'll also send you this information via email. So you just have it for your use. As always, we want this space to feel comfortable for everyone. So hopefully this is not an issue, but again, this is a space that we want to be supportive, encouraging, and empowering. So if at any point and at any space, you feel like someone is not moving in that way that honors this space, please let us know. We'll follow up. So building best practices. So each team, you'll be in your own kind of Zoom room. I want to pull out the things that come to mind. Center the folks most impacted by the problem. While you may have some great apps for yourself, definitely really still think about the people, the person or the persona that you feel like would be impacted by the problem. The other thing, take breaks, right? Take a breather. For some of y'all, this is your first hackathon. For some of y'all are hackathon veterans. So just kind of take a breather, enjoy it. Don't worry too much about your code quality. We are literally asking you to build in a few hours. I am not expecting, production level code that, can be shipped to millions of people, right? So, but definitely, as much as you can, try to get like a functional prototype that you can kind of show people what they could expect. The other thing I would encourage y'all is things will not go as planned. Hackathons always kind of throw a little wrench. So that could sometimes look like, maybe your teams might get moved around. Maybe you might have to kind of adjust on the idea. Just be adaptable and kind of iterate, right? So again, have fun. I would say that is in essence, that is what I hope for y'all. So in terms of just kind of some folks that'll be here, so we have a help desk with some maternal health consultants. So you'll see them on screen. So these folks will be here throughout the day and they'll be able to kind of support you if you have questions. For a lot of folks, like some folks may not be super versed in the topic, but if you're like, hey, do you have an idea about this thing that I'm trying to build? They will be great help for you. And we have a link for the virtual help desk, and we'll let you know about that. We also have I call them my tech floaters. So Alex has actually participated on a previous hackathon, popped in on the last one. And so Alex will be available. Anthony will be popping in and out. Anthony is actually also working on another hackathon. So that's why, I'm like mostly Alex, but Anthony will make himself available throughout the day. Our judges, oh my gosh, I'm very excited. Don't try and DM Arca though, to try and influence on this thing. But one of our judges, we have Arca. Arca is also on our planning team and just an amazing, talented leader. So definitely super excited to have Arca as one of our judges. We have Melissa Hanna, who is the co-founder and CEO of Mommy, has also built out an amazing solution. And we also have Natasha Kavanaugh, who is our VP of Social and Environmental Impact here at Twilio. So you have some powerhouse judges who bring a wealth of experience. So we're super excited to have them join us. So, what are we judging you on, right? So impact is one. So social impact, technical feasibility, like what did you build? So that'll be a factor. Cultural relevance, like the people that is this relevant to the audience that we've asked you? And this is important when you're building any tech solution, right? You definitely want to make sure the folks that are most impacted are finding the most value. And the new thing that we've added this year is the use of emerging technologies. So, every year there's always something new in tech, whether it's things like AI. So how are you sprinkling in just kind of the use of these emerging technologies? So those are kind of your criteria. Again, these things will be shared again. So you don't have to just rely on this. So your prizes, we're going to have prizes. I'm not saying we need to be competitive, but there's some prizes at stake. So each member on the winning team will win $500. So, I mean, it's not a bad way. We'll coordinate with the members of the winning team. Also, we'd love to kind of share the stories of the winning team. So we might ask you to just kind of join us to do a demo again. And kind of share that out. So you might get a little extra visibility. But, again, everyone is a winner here. So, but again, there's some prizes at stake. So in terms of troubleshooting, Carly Thomas, that's whose email is on your screen right now. Carly Thomas is on the DevNet, but Carly will be kind of a partner, and you probably have seen her email floating around. If you have any issues, if you're missing a calendar invite, please send us a ping. And even if you have more questions, let us know. So we love to use this phrasing on the DevNet. We can't wait to see what you build. But seriously, we really can't wait to see what you build. And we're very grateful that everyone kind of joined us today. So I'm going to kind of stop the screen share and just kind of open it up. If folks have questions, if folks have excitement, share your heart. So I'm going to just kind of stop the share and just kind of let us all see each other's faces. All right, did anyone have any questions? No questions, anything?
Y'all are so silent. If you have questions, get off mute, you know? Wow, are you not excited? Okay. All right.
I'm excited.
Thank you. Thank you. One excited participant for the hackathon. Okay, thank you. Thank you all. Hopefully this was like helpful information. Again, like, you know, we understand this might feel new for y'all, but please don't take yourself too seriously. Like, I think this is a heavy topic as is. So leverage innovation as a place to bring light, leverage innovation as a place to kind of, you know, just like innovate, and create, yeah, some light in the midst of some dark scenarios. But thank you again, everyone, for joining us. As Carly mentioned, we're going to pull you into some breakout rooms. So if you're in the hackathon portion, just kind of, you know, linger around. This will be a space where you're able to start to connect with your people. So, all right, I think that concludes it for this portion.